Hey everyone, my name is Lorne and welcome to my channel. So throughout this channel, I'll be taking you guys on a journey with me through my physical medicine and rehabilitation residency training, or rehab medicine, or PM&R, or physiatry. But before we dive deep into what this awesome specialty is all about, let me just tell you a little bit more about myself. So I was born and raised in Montreal, Canada to two Haitian parents. I moved to the US when I was about 15, finished up high school and got a track scholarship to compete in the NCAA Division I program at FIU in Miami, Florida. And during my first semester is when I really made the decision of, what I really wanted to study. Initially, I was a pre-med major, but that was very intimidating to me. So I ended up going a different route. I got a bachelor's and master's in athletic training, which was really what merged sort of my passion for medicine and sports together, sports medicine. But at the end of my training, in 2010, in my last semester, there was an earthquake that happened in Haiti, January 12th, 2010. After the earthquake, everything in my soul wanted to be in Haiti to volunteer to help any way that I can. But unfortunately, every single organization that I reached out told me, you're not a doctor, you're not a nurse, you're not a physical therapist, you are not qualified. And that was frustrating to me. So I was determined. I decided, you know what? I'm not going the athletic training route anymore. I'm going to finish my degree, study for the MCAT, and I'm going to medical school. It wasn't until 2 years later that I got to volunteer in Haiti, and that was really what was my introduction to physiatry. While volunteering there, I got to work in their spinal cord unit. I worked in their amputee prosthetic lab, and I also work in their orthopedic outpatient clinic. And that's when I realized that this specific patient populations is really the one that I would love to spend the rest of my career working with. My journey to medical school was a little non-traditional. I took a few years before actually getting into med school, and the med school that I actually attended was outside of the US. It was called Ross University. I spent 16 months in the Caribbean, an island named Dominica, and the last 2 years of medical school I spent in the US, where I did all my clinicals like a typical medical student. Coming into medical school, I already had an idea of the specialty I wanted to go into, right? With my experience in Haiti. So I knew either orthopedic surgery or something rehab related, but I didn't quite know what it was. I didn't really come across a lot of physiatrists during my med school training, so I really had to go out on my own to do my own research. Some of the things I did were attending national conferences, finding mentors online, making connections through the people that I met, and that's really what landed me my fourth year elective in PM&R, which I did at National Rehab Hospital in Washington, D.C. So throughout my third and fourth year of medical school, I didn't really get any exposure to the field of physiatry. But one thing that I realized going through every single one of my rotations is that as much as I enjoyed what I was seeing, the patients I was treating, the medicine that I was learning, I always felt like there was something missing. I had all my other classmates, and when we're on our surgery rotations, we're like, oh my gosh, I see myself doing surgery. Same thing, internal medicine, I would have another classmate that's like, oh my gosh, this is the field I want to go into. I genuinely enjoyed the majority of my rotations, but there was something missing. I always had that question of, okay, we've had this patient that's had osteomyelitis and they've gone through their below-knee amputation, but what's next for them? We have a patient that has a spinal cord injury and they're paralyzed from a certain level down. What's next? Or someone that has shoulder pain and it's sort of changed their life completely, even the work that they were able to do. What is next? So my question was always about the follow-up and seeing what would happen to the patient afterwards. And what I realized is that physiatry was all about that continuity of care, to see your patient once they've had that injury and how to improve their quality of life. And in some situations, you can get them back to 100%, and in others, it isn't. But the fact that you're able to provide them and resources to improve their quality of life is what I appreciated. And the more research that I did, realize that it's such a broad field. There's so much that it offers in terms of the type of patients that we deal with. Everything from a sports medicine side and dealing with athletes to individual disabilities that want to still compete, do it through adaptive sports, to pediatric rehab, to a patient that's had a stroke. a brain injury or has had a really bad accident, and because of that accident, they're under our care. So I'm really excited to go into the field. I want you guys to stay tuned and follow me along my journey as I learn more and also share it with you. Thank you so much. I look forward to seeing you guys. Don't forget to like and subscribe. Bye.